Hello everyone, and thank you for joining us in this talk, which is about COVID-19 and Arabic Twitter. How can Arab world governments and public health organizations learn from social media? Done by me, Lama Al-Sudais, and Dr. Pur Rice. As we know, the current coronavirus disease outbreak is of a major global concern and is classified by World Health Organization as an international health emergency. Governments around the world have taken different decisions in order to stop the spread of the COVID-19. People around the world use social media applications such as Twitter to find the news related to COVID-19 and/or express their opinion and feeling about it. We assume that governments and public health organizations may benefit from mining the topic discussed between people during the pandemic. This may help in understanding the population concern related to the diseases and help to find the best solution to protect people. The previous research in this area has been on English Twitter content, while few in Arabic. Arabic language is spoken by around 400 million people in the world and has more than 26 dialects. The problem of dialects is the meaning difference in the less formal settings such as social media. In this paper, we have combined qualitative and quantitative studies to analyze Arabic tweets, aiming to support public health organizations who can learn from social media data along various lines. First, analyzing the topics discussed between people during the peak of COVID-19. Second, identifying and detecting the rumors related to COVID-19. And finally, predicting the type of the source of the tweets about COVID-19. In this slide, I will explain the update of the Arabic infectious diseases ontology, which integrates the scientific and medical vocabularies of infectious diseases with their informal equivalent used in general discourse. These terms were then used in our collection process. To build dataset, we collected the tweets related to COVID-19 from December 2019 to April 2020. We have collected approximately 6 million tweets in Arabic during this period. We obtained the tweets depending on 3 keywords: corona, and COVID-19, which means coronavirus, misspelling of the name of coronavirus and COVID-19. We collected the tweets weekly using Twitter API. Here is the pre-processing steps of data. First, we manually remove retweets, advertisements, and spam. Then, we filter out URL mentions, hashtags, number, emojis, repeating characters, and non-Arabic words using Python scripts. After that, we normalize and tokenize the tweets. And finally, we remove Arabic stop words. The resulting data set was around 1 million unique tweets from the original around 6 million collected. This figure shows the numbers of Arabic tweets about coronavirus each week, with specific date highlighted to show the government decisions on protecting the population from COVID-19. We performed 3 different types of analysis on the collected data. To better understand the topic discussed in the corpus, we carried out cluster analysis. To detect false information, we took a sample of the corpus, then classified the tweets. And to determine the veracity of the tweet, we extended our previous work to classify the source of the tweets into 5 types of Twitter users. In the cluster analysis, to explore the topic discussed on Twitter during the COVID-19 epidemic in Saudi Arabia and other countries in the Arab world, we subjected the text of the tweets to cluster analysis. After pre-processing the tweets, we used the n-gram forms, unigram, bigram, and trigram of Twitter corpus. We clustered them using k-means algorithm with Python scikit-learn software and set the value of k to be 5. To detect rumor, we applied top-down strategies, which is where the set of rumors is identified in advance and the data is sampled to extract the post associated with the previously identified rumors. In our data set, out of 1 million tweets, we sampled 2,000 tweets to classify them for rumors detection. We manually labeled the tweets to create a gold standard data set and then applied different machine learning algorithms in this part of our study. We manually labeled the tweets with 1, -1, 0 to represent false information, correct information, and unrelated content. Our reference point for deciding whether the content contained true or false information was based on the list issued by the Ministry of Health in Saudi Arabia. This table presents the list in both Arabic and English. And this table shows some example tweets for each label. We applied 3 different machine learning algorithms: logic regression, support vector classification, and naive Bayes. To help the classifier distinguish between the classes more accurately, we extract rather linguistic feature. The selected feature fall into groups: word frequency and word embedding based. We used 10-fold cross-validation to determine the accuracy of the classifiers. To predict the source of the tweets, we replicate the logic regression model for our previous study, which was useful for classifying tweets into 5 categories: academic, media, government, health professional, and public. We use logic regression model because it's previously achieved the best accuracy, which is 77%, and deployed it to predict the source of the COVID-19 tweets that we had already labeled. Next, I will discuss the result of the 3 models. Our cluster analysis of the 5 main public topics discussed in tweets contents as follow: disease statistics, priors, diseases location, advice for prevention education, and advertising. This figure illustrates the 5 topics of COVID-19 tweets with examples. The result of our manual labeling process is 15.8% represent false information. This figure shows the accuracy of on score, recall, and precision on our corpus using logic regression. The other algorithm figures results are in the paper. The highest accuracy is which is 84.03 was achieved by the logic regression classifier with count vector set of features. In the source type prediction, the model predicts the source type of each tweet. This table shows some examples of the tweets with predicted labels by the model. We focus on the result of the false news content since they are highest importance of the public health organizations. In the conclusion, in this paper, we identified and analyzed 1 million tweets related to the COVID-19 pandemic in the Arabic language. We performed 3 experiments which we expect can help to develop methods of analysis suitable for Arab world government and public health organizations. The cluster topics are COVID-19 statistics, prayers for God, COVID-19 location, advising, and advertising. Our second contribution is a labeled sample of tweets annotated for false information, corrected information, and unrelated. Around 60% of the rumors related tweets are classified as written by health professional and academic, which shows the urgent need to respond to such fake news. There are many different directions related to analyzing social media data on the topic of pandemics. Since the false information play a dangerous role in topics related to health, there is a need to enhance and automate the detection process supporting different language. Other directions include monitoring the spread of the diseases by finding the infected individual, defining the infected locations, or observing people that don't apply self-isolating group. Finally, the analysis could be in thematic way, such as discovering further topics discussed during the pandemic, as well as assisting government and public health organizations measuring people concern resulting from the diseases. Thank you for your listening, and if you have any question or feedback, you can email me and I'm happy to answer them.